Healthcare workers play an important role in protecting patient health, but they also face certain workplace risks. One of the most important safety concerns in healthcare environments is exposure to bloodborne pathogens. In the United States, healthcare organizations must follow strict safety guidelines to protect employees from exposure to infectious materials. In this video, we will explain what bloodborne pathogens are, why this training is important for healthcare employees, and how it helps create a safer work environment. What are bloodborne pathogens? Bloodborne pathogens are microorganisms present in human blood that can cause diseases in humans. These pathogens can be transmitted through contact with infected blood or certain bodily fluids. Some of the most commonly known bloodborne diseases include hepatitis B, hepatitis C, and other infections that can pose serious health risks. Healthcare workers may be exposed to these pathogens while performing tasks such as handling medical equipment, treating patients, or cleaning contaminated surfaces. Because of this risk, understanding how to prevent exposure is essential for maintaining workplace safety. Why bloodborne pathogens training is important. Bloodborne pathogens training is important because it helps healthcare employees understand how to protect themselves and others from exposure to infectious materials. In the United States, workplace safety regulations require employers to provide training that helps employees recognize risks and follow proper safety procedures. Without proper training, employees may unknowingly expose themselves or others to harmful infections. Training helps employees understand how infections spread, how to use protective equipment, and how to respond safely if exposure occurs. This knowledge plays a critical role in reducing workplace injuries and maintaining a safe healthcare environment. Common situations where exposure can occur. Healthcare workers may encounter several situations where exposure to bloodborne pathogens is possible. These situations include handling needles or sharp objects, cleaning up blood or bodily fluids, and working with contaminated medical equipment. Accidental injuries, such as needle sticks or contact with open wounds, can increase the risk of infection. Understanding these situations helps employees stay alert and follow proper safety procedures to reduce risks. What employees learn in bloodborne pathogens training. Bloodborne pathogens training covers several important safety topics. Employees learn how to identify potential exposure risks and how to use personal protective equipment such as gloves, masks, and protective clothing. Training also explains proper procedures for handling contaminated materials and disposing of medical waste safely. Another important part of training is learning what to do if exposure occurs, including reporting procedures and seeking medical attention. This training ensures that employees are prepared to respond safely in real-world situations. Why healthcare organizations require this training? Healthcare organizations require bloodborne pathogens training because it helps protect both employees and patients. Following proper safety procedures reduces the risk of infection and ensures compliance with workplace safety regulations in the United States. Training also helps organizations maintain a safe working environment and avoid potential health risks. Employees who understand these safety practices are better prepared to perform their duties safely and responsibly. Where healthcare employees can learn this training. Healthcare employees and job seekers can learn more about bloodborne pathogens safety training through online compliance training programs. You can explore training options at compliancecoursesonline.com, where courses are available to help employees understand workplace safety, compliance requirements, and healthcare regulations. The link for this course is given in the description below. These programs are designed to help workers build essential safety knowledge required in healthcare environments. Bloodborne pathogens training is an essential part of workplace safety in healthcare settings. By understanding how to prevent exposure and follow safety procedures, employees can protect themselves and others from serious health risks. Learning these safety practices helps create safer healthcare environments and supports professional development in the healthcare industry. If you found this video helpful, consider subscribing to the channel for more videos about workplace compliance training, employee safety, and professional development across different industries.